Good afternoon. Thanks again for everybody being here today. First of all, before I get started, I know Dr. Williams is going to be out here a little bit to talk about the testing. I think that just got released earlier today. I think there was around 14,000 tests that were backlogged through Quest, I believe. Of that 14,000, 106, I think around 160 some odd was positive, but I'll let Dr. Williams give you the exact numbers on that. But I think it's just important to know that that was a backlog of about 3 days that come in. So the good news is 13,000 of that was negative, over 13,000 was negative, and 163 positive in that batch. But I'll let him talk about that when he comes up here shortly. Today I had a chance to talk with the Missouri Chamber of Commerce on a Zoom call, as well as several Kansas City area chambers today, and it was kind of good to be out to talk about the economy again, to talk about workforce development, to talk about where we're headed in the state of Missouri, and some positive things that were going on, and what we had done on the COVID-19, and how we were how we were moving forward on COVID-19 to move the businesses forward in the state of Missouri. So I think everybody was upbeat, trying to find ways that we get people back into the economy, get the businesses back open, and getting back to some sort of a normal lifestyle as much as possible. We did have our opportunity to talk about some businesses that were opened in the Kansas City region. Of course, we was up there about a week ago to Burns and McDonald up there. The expansion they had up there was an extremely large expansion up there. This week, Accenture in St. Louis, 1,500 or 1,400 new jobs up there. A couple of more companies we're going to be able to announce, I think, in the very near future that's maybe going to be moving back to Missouri. So a lot of good things are happening in the state. We just got to stay focused, realizing, as I say again, we have to do both, keep going with the economy, open up the economy, keep building our business platforms in this state, focusing on infrastructure and workforce development, at the same time deal with the virus and make sure that we're doing everything we can to keep the people to stay safe and to move forward as school season's not too far away to start preparing for that. So a lot of things going on in the state right now. And Missouri continues to move forward, and the new school year is right around the corner. And it seems from where we started in January, and we wasn't even thinking about school. Now here we are thinking about opening the schools again, the universities, getting the kids back into the rhythm of education, which we got to get them back in there and get that done. So we're looking forward to that happen. And I know there's a lot of questions about what school is going to look like this fall. And the Missouri Department of Elementary and Secondary Education has been working to develop guidance for Missouri school districts. And today, Commissioner Van Dieven's here with us today to give us an update on that. So, Margie.
Thank you, Governor. Good afternoon. Just 3 months ago, COVID-19 forced the closure of school buildings. School leaders quickly put plans into place to continue educating and feeding our students in ways never before done, all to protect the health and safety of our students, staff members, and communities as a whole. And I want to again express my gratitude to our school leaders, teachers, and fellow support staff members, as well as Missouri families, for taking care of our kids throughout this time of uncertainty. We're now 2 months out from the start of the coming school year, and students, families, and school staff members continue to think about what the academic year might look like as we continue to face the global pandemic. The situation continues to evolve, and there are still many uncertainties, but here are some things that we do know. There's a great digital divide in our state. While educational opportunities continued to be provided during the school closures, 1 in 5 Missouri students could not take part in those options. That means making any kind of long-term remote learning a real challenge for those students. We also know that families count on our schools for more than just education. Missouri schools have served over 19 million meals to students and families across the state while school buildings have been closed. We also know that hotline calls are down. The Department of Social Services has reported as much as a 50% drop in the number of child abuse and neglect calls that they're receiving. We know our educators and school staff members make many of those difficult calls to further protect the students they care about so much. And we know that schools provide kids much needed social interaction and development. Many have expressed concern about the adverse effect of behavior and mental health on our children that they may have experienced during the disruption to their normal routine, and social emotional growth. And finally, we know that schools being open are an important part of our economic recovery. Parents who work outside the home and don't have a way to do their work remotely are left with limited affordable childcare options and are often forced not to work. So while building closure was necessary in March, there are a number of serious consequences that can come from our students not attending school in person. These implications are being considered along with the continued risk of COVID-19, and therefore school leaders and local health officials are working thoughtfully to reopen our schools, knowing that school operations must take place differently to better protect public health and combat the spread of the virus. These decisions will be made at the local level, with school leaderships consulting with their local public health officials, as well as with their families, staff members, and communities. Many districts and charter schools across the state have asked their families and staff members what their comfort levels are when it comes to school reopening. From what we know about these survey results, it seems the majority of our families and educators agree they want to be back in school, learning in person, but with extra precautions. So last week, Dr. Williams and our partners at DHSS joined us to host a webinar for both school leaders and local public health officials so we could discuss the various guidance shared about school reopening. Here are some things you can expect to see from your local schools as they reopen. First, we will be communicating to families and school staff members the importance of staying home when you're sick. Now, that's really a paradigm shift for us in education, as we're often accustomed to toughing it out when we're not feeling well. We've encouraged schools to do away with things that are counter to in our shift of thinking, such things as perfect attendance awards or attendance incentive programs. You'll be seeing changes in regards to attendance at the state level as well. In Missouri, student attendance is used in both districts' accountability measures as well as school funding calculations. The State Board of Education will be waiving attendance for Missouri School Improvement Program, the MSIP accountability metric, and we will be working to make sure that we're addressing ways to make payments for school districts for in-seat learning, virtual education, or a combination of both of those methods. Next, you will also hear an increase on the emphasis of good hygiene, screening, social distancing, and masks where appropriate, as they are all layers of protection. These strategies aren't foolproof on their own, and some practices might not be as feasible for certain students or certain schools, but multiple layers of protection help. And third, it will be essential that school leaders and local health officials continue to work closely together. For example, school leaders can help make contact tracing as simple and as efficient as possible for health officials should a positive case occur. This means having organized documentation to account for student and school staff members and their interactions. There are also a number of education-specific issues that our agency is working quickly to address as we look at reopening Missouri schools. We have pulled together a group of educators to form a task force for learning acceleration that is working to develop tools to help schools identify specific gaps in student learning, both academically and in regards to social emotional development. Once identified, targeted supports and appropriate interventions can be provided to get students up to speed upon returning to school. Similar to adults, students may be experiencing this pandemic in different ways. This pandemic has heightened our awareness of the digital divide, and we will continue to focus attention on addressing equitable access to technology and the internet. Education will look different in the future, so educators need more training and professional development to do their jobs differently and provide instruction in this new way. We're proud to be working with a number of celebrated teachers to develop a professional development video series to share the distance learning strategies that worked well for these great educators that they can share with educators across our state. So we look forward to sharing more information about these important questions in the coming weeks. We are all in this together, and we're all stand ready to make the necessary adjustments to continue doing what we have always done, and that is improving lives through education and giving our Missouri students access to opportunities to fulfill their potential. Thank you.
Margie, thank you very much. Thanks for what you're doing at DESE and for the words. You know, I also want to thank the administrators, the teachers across this state for stepping up at a time like we've not seen. You know, instead of complaining and saying things about the way the situation is, the only thing I've known since I've talked to superintendents, the administrators, teachers across this state, the only thing they've did is step forward, realize the situation, are starting to prepare, teaching our kids, and that's been their priority every time I've had the opportunity to talk to them on the phone. I think that with the budget situation, they're doing extremely good job out there meeting the demands of the education, what we're going to go through, and again, making the kids a priority over everything else. So I want to thank them. I want to thank them for understanding the situation. They know, like everybody else in this state, the situation we're in, the way the economy is, and what the budget situation was. So they're doing a good job to move forward, and I appreciate Margie and her leadership and DESE and what they're doing right now to get those kids back in school. As I said Tuesday, workforce development and infrastructure will be a critical part of Missouri's recovery. Before COVID-19, we were making great progress with infrastructure, such as the Rochport Bridge, focuses on our bridge programs across the state, cost share programs across the state. And as we continue to recover, we are excited to get this momentum going again and move forward with critical infrastructure projects across the state. Today, Director McKenna is here to give an update and share some news about a grant MoDOT recently received. Director?
Thank you, Governor. Good afternoon. You know, we are making progress across the state. Our construction industry is responding amazingly well throughout this pandemic, and we're getting good work done. We're having a great construction season so far. The construction industry is implementing social distancing, and they're getting the job done. We have over 400 construction projects going on throughout the state. All good news. But, you know, we're also seeing, in spite of that, and maybe because of it in some cases, we're seeing an increase in traffic fatalities in Missouri's highways. Despite the fact that traffic volumes have been down for the last several months, almost as much as half off of normal times. In 2020, we've seen 402 traffic fatalities, which is an increase of 43 more lives lost compared to the same time last year. Consider this fact, that nearly 70% of those lives lost did not wear a seatbelt. They did not have their seatbelt on, and had they had the seatbelts on, we'd have 100 more of our citizens here with us today. And while it's easy to throw those statistics around, we have to pause and remember that those 100 deaths are people someone knew and loved. Think of the staggering ripple effect those deaths have on the people left behind. You can ask any highway patrol trooper what one of the toughest parts of their job is, and they'll be sure to tell you it's contacting a victim's relatives to tell them of their loved one having been killed in a crash. For 3 straight years, we've seen a decline in traffic fatalities, only to experience this year's unfortunate increase. Just as we see people wearing masks and social distancing, not only for their own protection, but for the health of others, we need a similar commitment from drivers to buckle up their seatbelts, put their phones down, and slow down. This is even more important during this time of the year when we experience the 100 deadliest days of summer, the period between Memorial Day and Labor Day. Summer is also the peak season for highway work zones. We're already seeing a disturbing trend in our work zones this summer, with rampant disregard for speed reductions and lane restrictions, along with general inattention. Just a few weeks ago, 3 MoDOT vehicles were hit in the same week in the St. Louis area. In 2 of the 3 hits, the drivers just took off. We're taking a look at the data across the state to see what additional actions we can take to keep our workers as well as travelers safe in our work zones. One move we're considering is full road closures in areas where we're experiencing high vehicle hits. We know the public doesn't like to be inconvenienced this way, but if that's what it takes to make sure our workers go home alive at the end of their shift, that's what we'll do. On a brighter note, and as mentioned by the governor, I'm happy to report that Missouri is one of just 10 states to receive a discretionary grant from the Federal Highway Administration to implement technologies that will improve mobility and safety for travelers. It's a $1 million grant, and it'll be used for predictive analytics on our I-270 project currently underway in St. Louis. The project will use predictive models that consider several different factors, such as traffic volumes, weather, or special events, to determine the likelihood of crashes and identify response times. We're going to put information in the hands of users to be able to move around those areas. It's really exciting developments. It's being developed in several places across the country, and we're happy to have that on such an important project. I'm also pleased to provide an update on the governor's Focus on Bridge program. We've placed a total of 114 bridges under contract already. We've completed 13 and currently have 58 under construction. In fact, one will open tomorrow afternoon, the Missouri Route 79 bridge over McLean's Branch in Lincoln County. In total, and mostly prior to the pandemic, this year the Missouri Highways and Transportation Commission authorized over $1 billion in construction awards. That's the first time we've breached $1 billion in awards since 2010. Our construction industry partners, as I mentioned before, are doing a wonderful job maintaining their workforce safety while doing great work on the roadways. We have over 400 active construction projects going on. I also want to briefly touch upon another aspect that's affecting transportation. We are experiencing a drop in transportation revenue as a result of the pandemic. Motor fuel taxes, motor vehicle sales tax, and others, they're off. The department's facing an estimated 30% loss of state transportation funding for a limited period of time. Revenues thus far were off plan by about $45 million. And that's with economic activity through the month of March. We still have April and May to work through, and we anticipate further impacts once we've had all the data. To address the revenue shortfall, the department has slowed discretionary spending on equipment, materials, and supplies since early March. We've slowed new hiring, and we've delayed advertising on approximately $360 million worth of construction projects, which is mostly federal source revenue. We've most recently applied through the Department of Labor and Industrial Relations for the Shared Work Program. The goal of the Shared Work Program is to save jobs by saving payroll dollars through a reduction in employee hours while enabling eligibility for unemployment and CARES Act benefits. Our senior team has taken a pay cut, and the employee work week has been reduced to 32 hours per week. An option was also provided for employees to opt out of shared work with a 5% reduction in pay. We're taking these measures to be able to save state road fund dollars, preserve private sector and public sector jobs, and minimize the financial impact to employees by participating in this shared work program. We anticipate these salary reductions being in effect until September, unless federal action enables modification. I want to thank the entire MoDOT team for keeping the transportation network open during these challenging times and for the sacrifices each of you make to serve the public. For all the travelers on the roadways, please take care in work zones. Observe the speed limits and always, always buckle up and put your phone down. Thank you so much.
Thank you, Patrick, for that update. Thank you for what you're doing at MoDOT and still keeping that construction going out there, and that's important, and trying to make sure all the employees out there are safe. And finishing up today, I just want to say we'll be back next Tuesday. Over the weekend, I want to remind everyone to please continue being safe and proactive. I also want to remind everyone that we continue to hold community testing events throughout Missouri. We have already held community testing in 40 counties across the state, and we'll be holding testing events in another 10 counties over the next couple of weeks. We encourage any who wants to be tested to register through the Department of Health and Senior Services. Any Missouri residents who would like to be tested for COVID-19 can do so at these sites at no cost. You do not have to live in the county or experiencing symptoms. Again, while certain areas may experience outbreaks, this does not mean there has been a second wave. We are now able to aggressively test in these areas and box in the virus. Overall, Missouri is still in a good place. We constantly monitor the data across the state, and our positive rate continues to decline. Missouri is recovering, and we are moving forward. Thank you, and God bless. Kelly will take questions. Dr. Williams also back here today if you have questions for them. Kelly?
Okay. Commissioner Van Dieven? With that extra noise, you may need to speak up a little more. Sure. Okay.
Hey, Commissioner. So one of the big topics of conversation in Columbia has been the school district's decision not to require masking in schools as part of their reopening plan. What's DESE's stance on masking specifically, and what was the thought process behind that?
So I don't know their thought process behind their thinking. We've left that to local decision making because, again, circumstances vary across the state. The age of the child certainly makes a difference. The ability to social distance. There's a lot of factors that go into the mask decision making. So we have left that to the local level.
Is there a set deadline for schools to request a change in start dates?
There is not a set deadline. And to date, we have received very few requests to move up the start date. The majority of our schools are still planning to start on August 24th.
Hi, Commissioner. You mentioned that 1 in 5 students weren't able to access virtual learning. So if, in the case that schools have to be shut down again in the fall, if there's a resurgence or something like that, what is the department doing right now to continue to address the virtual divide? Yeah,
this is a big issue for us at the department and for the entire state. And I appreciate the governor's support in this. We've had a number of conversations with the governor's office on this concern about access to broadband and services for our children, for our families, because again, just as a reminder, the schools are able to access this typically. We're talking about wanting to get into children's homes, and truly believe that every person in the state of Missouri should be able to access that, and appreciate the governor's support in that work.
2 quick questions for you. First one, is there any sort of thought of possibly making class sizes smaller, or does that once again go back to the local school districts?
Yeah, it'll be a local decision, but there's a lot of thought going into that. When they're trying, that's exactly where our leaders are right now, is trying to think about the best arrangements to make for students in schools. And again, we'll be left to the local district. We could not make that decision at the state level. Classrooms are different sizes. What's happening in each of the regional communities is vastly different. But I can assure you that is a primary topic of discussion for our school leaders right now.
And at this past month's school board meeting from the state, they discussed about virtual learning and how a parent has to, if they do submit that they want their student to learn online, there is no set time, calendar days, that the school district has to respond to them. And I know that that's something that they're going to look again in their August board meeting.
Right.
What is your thought on that? Is that something that you're implementing just because of this COVID, or something that you're thinking about?
Actually, this part is being implemented because of the new state law that was put into place last year. And there were some components that weren't clearly addressed in the law. And so now that we've had a year to implement it and seen where some of the clarity is needed, we're implementing a rule. And so that's why when you post a rule, you have 30 days for comment. That rule is going to be out for public comment prior to the August meeting. I believe it's going to be posted July the 1st. But you can check our website for the exact date on that, and would welcome people's feedback on that rule. So that's why.
Just going back to the digital divide, have you noticed certain parts of the states that struggle, that the divide's a lot bigger, like in different parts of the state compared to others?
Yeah, and that's the other thing that's really interesting. It comes in there are different reasons as to why that digital divide exists. So it's part of our remote and rural areas. It truly is the broadband expansion that we're looking at, and so you'll see some of that. In some of our urban areas even, the divide exists there as well. And so parts of it are true access to the Wi-Fi itself. Part of it is access to equipment Part of it is affordability in general. So there's just, we have a whole big spreadsheet out there again on our website that'll show maps out by county what issue has been identified as the primary concern. But it looks different across the state.
There have had to been some withholds, and the governor announced that the hold harmless agreements are being waived. Were there any schools that actually dipped below levels of funding in previous years that were affected by that hold harmless agreement being waived?
Sure. We had a number of districts that are listed. I believe there are about 191 that are considered hold harmless. And, you know, the reality of that is when you're taking something like a withhold that wasn't factored into the actual law when it was written that way, you really have to think about how something like one full payment will impact all districts across the state. So we think it's in the best interest to really divide that evenly across the impact evenly across each district.
And is that waiver connected to the state of emergency?
Yes.
Okay. So is that waiver going into the next fiscal year that starts July 1st?
Yes.
Okay.
All right. Thank you, Commissioner.
Thank you.
Director McKenna.
Thank you. Director McKenna, good afternoon. Two questions. If you could talk about the status, the current status of the I-70 Rochport Bridge. I know you briefly mentioned it at the hearing today, but I didn't hear any specifics. What's the status of that? And then you mentioned 13 bridges done, 58 under construction, and one tomorrow will open in Lincoln County. If you talk about the Lincoln County project, and is that the $350 billion bonding plan the governor had a year ago, or what is that specifically?
Well, I wish it was a $350 billion bonding plan. It was $350 million. Yes, that is the governor's focus on bridge plan. We had envisioned about 250 total bridges, and within this is before the fiscal year is concluded. We've already got 114 of those under contract. Our team and our consulting partners have been working very hard. The bridge that's opening tomorrow in Lincoln County, it's just under $1 million, about $890,000 project, and it's replacing a bridge that was built in 1938, and that will be upgraded to current standards. Is going to be 8 feet wider and 20 feet longer, so it's really going to serve the communities that are impacted there very well. It's the perfect type of thing for the governor's focus on bridge program. Projects all across the state are being impacted, being done, and frankly, the legislature and the governor working together to come up with the bonding program means we have the money in the bank. So those projects are going unabated by current economic conditions. So that's a really good, it's a wonderful circumstance to have. With regard to Rochport, we're still in the planning phase of that. The good news, though, is part of that project was climbing lanes for Mineola Hill, and we are underway there. We're making good progress, and we're hoping by the end of the calendar year we're actually going to have a climbing lane at Mineola Hill. That's the first part of that project. We have substantial additional work on environmental work and engineering before we get to the point of putting out a RFP for construction services on that. We're also looking at the Buck O'Neill Bridge as well. We have delayed the advertising of that. Was originally scheduled for the middle of May, but we actually reduced our own internal time at the department. We haven't impacted the project schedule at all. We think we're going to be out for an RFP for design build by probably August of this year. We'll do an advertisement most likely in July. And so we're proceeding at pace. We have an impediment to that process we're going through right now. We're pushing through, but for the folks in Kansas City, they should know we're not going to have any delays that we anticipate that will keep us from drawing down the build grant. That was a big part of the financing package for that.
Hi, sorry if I missed this earlier, but when you were talking about all of the different accidents and fatalities, do you know like how many of those accidents did distracted driving, like being on your phone, played a role in that, and of those fatalities, did any distracted driving play a role in that as well?
You know, it's one of the most difficult things for anyone to really put a direct cause and effect on. It's very difficult for law enforcement to have that judgment effect. But anecdotally, I believe that virtually all of them do. We are seeing, and we're getting reports in from our folks in work zones right now, that they rarely see anybody not talking on the phone. It's at a very large proportion, and that is a hugely damaging thing, particularly if some of the other behaviors like speeding or other distractions are involved. We do believe that distraction is one of the main causes, even if we can't prove that. It just seems like the work in the last 10 years in a lot of the research that we've seen over the last 10 years shows that we should be seeing a lot faster and a lot better safety reports, particularly because the vehicles are getting so much safer. And we're not. It's counteracted by what we believe is cellular use distraction during that driving activity. We really, we're encouraging our Buckle Up, Phone Down campaign has now spread to about 8 other states. We've gotten word that NHTSA at a national level is going to be picking this up. They're looking at the possibility of making this a national campaign. We think it's that important.
And with just like cuts to advertising, how are you going to keep getting the message out there about distracted driving?
We work together with a coalition for safety in Missouri. We develop a blueprint for safety. We actually have federal guidance that we have to follow, and some of that safety money that comes from the federal government actually has to be spent on public awareness campaigns. So we're really trying to focus those efforts, use as much awareness as we can. And on the MoDOT website, we encourage everybody to take the challenge. We have a challenge out there to sign up, the Buckle Up, Phone Down Challenge. You know, we have over 500 businesses and over 13,000 people have taken that challenge. It's kind of it's just a pledge to put that phone down and buckle up while you're driving. Thank you.
2 quick questions once again. Any furloughs for any MoDOT workers, and what about their pay? Has it had to be decreased because of the COVID-19 pandemic?
Yeah, we are participating in the shared work program with the Department of Labor and Industrial Relations, and that actually is a department-wide reduction of work hours by 20%, so down to 32-hour work week, and that's also a 20% reduction in pay. But participating in the shared work program actually provides, through the employer, access to unemployment insurance to cover that difference or part of that difference, and access to the CARES Act benefits. Now, we're going to run this for about 12 weeks, and we believe that the vast majority of our employees will see no negative financial impact when they net it out over that 12-week period. The purpose of the program, and the partners over at Department of Labor have been wonderful working with them, as well as the Office of Administration, to help us set this up and go through it. The purpose of the program is to save those jobs. We think there is really good news on the horizon at the national level with regard to transportation investment, and we're going to need all hands on deck to be able to execute that plan.
Yesterday on Twitter, I saw that another MoDOT truck was hit. You talked about 3 happening within the same week just a few weeks ago. Yeah. How many are you up to so far this year or even this month, and is it more than last year?
Yeah, last year was a record. I think we had 38 vehicles hit in work zones last year. I don't have off the top of my head the exact figure for this year. I can get that, but we are seeing it's really distressing, because if you see these truck-mounted attenuators, the TMAs as we call them, they have lights and very bright. They're hard to miss if you're looking ahead of you at all. So it's very distressing when these get hit, and it's dangerous for the traveling public, because somebody striking one of those is absorbing that hit as well. So a very dangerous situation. We're just trying to get the word out for people to pay attention, particularly in those work zones.
Thank you.
You're welcome.
Thank you, Director.
Thank you.
Dr. Williams?
Thank you, Kelly. Just a quick update, if I could. Again, as the governor said, you'll see a statistical thing on the results today. We had 13,000 tests come back all at once from Quest, representing June 21st to June 24th, and about 160 of those were positive. So again, that's not a true day-to-day. As we're 2 weeks into opening up, we look at our numbers. Our R-naught is slightly over 1, which we find very encouraging, remembering that was, I think, 2.8 at the peak back in April. Our positivity rate, as the governor said, remains low. That's about 4%. And so we're very thankful for that, especially compared to other states. That's our 7-day rolling average. Our hospitalizations across the state are at an all-time low. Our ventilatory capacity is, I guess, the best it's ever been. So we're incredibly thankful for all of that. At the same time, we're still very vigilant. I've sent out remdesivir 3 times today to 3 different hospitals that asked for it. So there are patients who are being hospitalized who need that early on in their care, so we're acutely aware of that. We also are still very much focused on Southwest Missouri. I was on the phone with Paige earlier today down in McDonald County, and they're very vigorously doing their contact tracing. Have been in conversations with Tyson Foods and their management as they do their boxed-in testing themselves. The CDC arrived today. Their lead investigator arrived in Joplin this morning, I believe it was, and the rest of his team gets here tomorrow afternoon, so we'll be in conversations with them. And then the National Guard shows up tomorrow and Saturday in those counties to do community testing, as the governor said. Asymptomatic, we're happy to do it. We found that to be very helpful. And so we continue to watch around the state. Kansas City's R-naught has creeped up a little bit. Have been in conversations with Rex about that over there. And so Boone County a little bit up. Sent them some remdesivir today. So we remain vigilant and continue to watch around the state. But as we go into the weekend, we're thankful for where we are. Remembering that any case is one too many, but we're thankful that so far we've been able to stay on a trajectory that we find hopeful. Happy to answer any questions.
Hey, Director Williams. The CDC team that you mentioned, is this the first time that an actual CDC team has been called into the state? And if so, why were they called in now?
Yeah, they've been in Arkansas. They've been in Northwest Arkansas doing epidemiological tracing around the food processing plants. And you might remember last Tuesday, we were on a phone call with Arkansas, and they found them very helpful. So we called the CDC, and to my knowledge, this is the first time we've had boots on the ground from the CDC. We talk to them all the time. And so we really were piggybacking on what Arkansas has done. We know that there's some movement across the state in these populations, and so it just made sense. And Nate Smith, my counterpart in Arkansas, thought they were very helpful. So we're very appreciative they're here on the ground. They're mostly doing epidemiological investigation, trying to figure out if there are certain pathways the disease is being spread, and to help us identify those and to try to mitigate. So.
Currently, if you go to the covidactnow.com or .org, excuse me, Missouri is in red. That means critical. How is contract tracing going in the state? Is there enough numbers in the state, enough cases for you to continue doing that?
Well, as far as are there enough? I mean, we're doing contact tracing very much so, especially in Southwest Missouri. We sent contact tracers down to 2 counties. I talked to Paige today. She didn't think they needed any at this time in McDonald County, so we haven't sent any there. It's an integral part of our strategy to do contact tracing, to work, and that's done through our local health departments unless they request our assistance. And so very much a part of our strategy going forward is to layer on the contact tracing to the testing. Once you do the testing and identify people, then you come in and do the heavy lifting of identifying people to either isolate the patient or quarantine their contacts.
Can you kind of quantify how a hotspot becomes identified as one, and what triggers the box-in response?
Yeah, Philip, that's a great question. Well, it's easy for long-term care facilities. One resident or one staff member of our 1,200 long-term care facilities, by rule, has to be reported to us by the facility within 24 hours. And that's also true for prisons and dormitories, for that matter. So that's the trigger for that. Now, when you get to other things that are outbreaks, whether that be a food processing plant or an event or a prison, We look at, we get feedback from the local health departments. I'd say most of the time they alert us and they say, look, we're seeing an increased number of cases down here that we think are a result of this either geographical entity or a living entity or some nidus where we think those cases are from. An outbreak was we had a hairdresser in Springfield that was an outbreak, or at least we worried it was. It turned out not to be. So it's clinical judgment for anything other than long-term care facilities in which institutes our box-in strategy. But we tend to be on the side, since we have such robust testing, to, if we don't have a definite number, subjectively we're more likely to go in than we're not.
And Texas today banned elective surgeries again. That seems like an intermediary between being fully open and fully closed, but it often comes at tremendous cost for hospitals.
Yeah.
What are your thoughts on that? And do we know how effective that was in the spring in preventing cases?
Yeah, again, just incredibly thankful to be in Missouri as I look at other states. As I said, our hospitalizations for COVID are really at an all-time low. Our ventilatory capacity is excellent. So I'm glad you brought that up, Philip, because that reminds me of something. We really, really encourage people to utilize healthcare now, to go in, and if you need surgery, to have surgery. We're going to release early next week our vaccination rates for, I think it's April and May for children, and they're low. We're going to put out a press release of that on Monday. And that really, and talking with my pediatric colleagues, that's very concerning. So I thank you for that question, because we really want to emphasize that here in Missouri, unlike Texas and some other states, our healthcare system is open to take care of people, and we highly encourage people to take advantage of that. That's a great benefit to where we are in Missouri, that you can go get the health care you need.
I'll take one more, Dr. Williams.
Hi, Dr. Williams. We had a report of a privately owned health care facility in mid-Missouri that had done some testing and had some positives, but had not reported. Is that, and that the state had to step in to help do contact tracing and things like that, because they were alerted by a patient who was never contacted for contact tracing. Yeah. The state, the city health department, the county, rather. Is that unusual, or is that something you're seeing?
No, that's pretty unusual, because as you say that, I'm not sure who that is, and I usually kind of know. It's a state law now that if you have a positive case in your facility, that you, the facility, not the provider's always been required to once they know, but now the facility has to contact us, and then we work with the local health department. So I would say that's really unusual, and obviously we would highly encourage, for the safety of their staff, for the safety of their residents, that there's a reason we do that we feel like this going in and testing everybody has been really helpful.
Right, thank you.
Thank you, Kelly.
Governor Parsons?
Let me do one follow-up to Dr. Williams, whoever just asked that last question about that, to make sure, let us know where that was. Was that or something? Because if it's a nursing home, we definitely want to be on top of that extremely well, because like I said, he said state law, but we want to know where those cases are at. We sure don't want that to linger on nursing homes. All right.
Hi, Governor. Even with this statistical kind of anomaly today in cases, we're still seeing record cases in the state. And I know you've been saying it's up to Missourians to protect themselves and protect the community. What would you tell Missourians that may be concerned that we are seeing these more record cases, and they're not seeing people? I've had callers say they're not seeing people social distance and things like that. What would you tell Missourians that may be worried?
I think it goes back. I think, one, you got to avoid that. If you have that concern out there, I mean, you got to stay away from places where there's crowds and stuff. That we all know that. Again, I'm going to go back to social distancing is key. If you're one of those people that says, hey, I don't believe all these people are staying far enough away, then I probably wouldn't be around that. You got to avoid those situations, especially if wherever age bracket you're in, wherever your health condition's in. Again, those basic principles. Look, I don't think you're going to be able to go out there and control that everybody stays 6 feet apart. We can say up here every day and try to recommend it to take whatever safety precautions you need. But again, people are going to have to take that upon themselves, and hopefully you've got the opportunity right now. Don't be in one of those high-risk areas. The other thing we know by doing more and more testing we know that there's more cases out there. And if I was a young person, as we see these young persons being tested more and more positive, because we're starting to find that out, what we do know is they're probably much more likely to be a carrier that could affect somebody else in some of those high-risk areas than they are themselves, because we know they're probably going to go home and, frankly, get over it, is what they're going to do. Most of them's not going to require hospitalization. But the big concern you have to have is who they come in contact, where do they go, and then who are they affected by that. So, again, it's a situation we just got to get through, and we got to make sure we keep using common sense in that, and don't put ourselves in risk if you don't have to.
Yes, good afternoon, Governor. Today, just a few moments ago, Director McKenna mentioned the 402 fatalities, Governor, and he said 70% of them were not wearing their seatbelts. As you know, Missouri does not have a primary seatbelt law. Your colleague, Bill Reibold, who a former Republican lawmaker, tried to pass that. He never could even get a hearing. Is it time to pass a primary seatbelt law in this state?
Yeah, I think it's sure a time to have a discussion on that. When you hear something like that, it's disappointing at the least. I'm going to go back, though, again. We pass laws, legislatures do every year. I've been up here and passed law after law. At the end of the day, you got to put a seatbelt on, and you got to buckle it. And that's going to go back to the people that are driving those vehicles. I sit there and think there's 100 people lost their lives. I don't know what all the circumstances were, all the wrecks, but just because they didn't hook up with seatbelt, and that has to weigh on us all. And even if you had a law in place, the question then is, do you use the seatbelt? But again, it's a combination of things. But look, I think things should be on the table. Things should be discussion. If you take my grandkids, for example, on the farm, sometimes you get in a farm truck, and I used to not wear a seatbelt all the time when I was on the farm. I was in there. But my grandkids won't even think about getting in a vehicle, and they'll be the first one to tell me to buckle up. So eventually that world that we're going to live in. And make sure when you ask my director about 300 million, you get that million instead of a billion. Don't do that. You got him on cloud nine in here thinking he's got $350 billion to spend now. So, all right.
Crystal?
Governor, Kansas City may soon require Kansas Cityans to wear face masks, and there are also other cities that are experiencing surges and talking with their county commissions and things like that about having maybe a city ordinance or a county-wide order that would require face masks, at least indoors. Would you be supportive of those local ordinances or cities that chose to go that route?
Yeah, I've said all along, it's up to local authorities to do that. Or if they want to require, whether the same way we did Kansas City, St. Louis, Columbia, every city, Springfield, had different requirements of how they had a closure of that, how they opened up. Again, it's up to local levels how to do that, and I've been pretty steady on that throughout this whole process to maintain. So.
And it doesn't matter that it's face masks. It's been controversial in other states.
Yeah, I mean, it's the same. I'm not sure what you mean by the last part of your question, but if the cities want to do that and they want to require that of their citizens that live there, then that's why they have elections in those areas. If people don't like it, they change it. If people like it, they keep the same people in place.
Thank you. So I know you mentioned you met with the chamber earlier today. They tweeted out a photo around an hour ago about several of the surrounding states having COVID-19 protections for businesses in case there are potential lawsuits. Did you guys discuss that, and what's your stance on that?
Yeah, we have. I've discussed that on several occasions. We talked early on about special session, whether we're going to have that. I'm sure that'll be part of a special session when that day comes. So we're still in the process of discussing those things, but that'd be part of a special session along with some other things. We still got some work to do on the crime bill. One of the things that was very disappointing last year, one of the major issues that the cities, the mayors, the police officers, the African-American community, the clergy, some of the things when it comes to the witness protection plans didn't get done last year. That was a big issue. That really addresses violent crime more than anything else. And if we have a special session, I'm sure we'll be discussing issues like that they're very important, that can have an immediate impact.
We'll take one more question, Governor Parson. Right here, ma'am.
Governor, going off topic of COVID real quick, earlier today, Kansas City's mayor introduced an ordinance to include a ballot question on local control of Kansas City Police Department on the November election ballot. What are your thoughts on local governments maybe doing the same thing, or even for Kansas City? Yeah,
what they'll have to do, it's a legislative issue whether they change the law here on that or not. I'm not sure what Kansas City, I'm not sure what the what he voted on or what they voted on in the city council. But I mean, it's fine for them to decide that, but the legislatures will have to make that change also to be able to do that. I know there's a couple other questions. You want to take a couple more? I'll take a couple. I'll take a couple more.
Thank you, sir. Representative Hicks has offered a bill, is filing a bill to deal with what he calls police abuse of force. Are you open at all to including police review or reform in a special session?
You know, we haven't talked about that at this point. I think we all see that there's going to be review of policy. I think we're all discussing that. I've discussed that with public safety. I know the cities are. I'm not sure that would be a special session just for that, but I'm not saying it wouldn't either. You know, I don't know. I think, again, as we try to talk about reform, you know, and you've all heard me say that I'm very supportive of the law enforcement community in this state, for those officers that go out there every day, and for the ones that do it right, day in and day out. I don't have any people that don't do it right, law enforcement officers that don't conduct themselves professionally, then I don't have any mercy for them. They need to be held accountable for that. But again, I think you're talking a process that's going to take some time to see what that is, see what changes we're talking about making. You know, it's one thing to talk about a chokehold, and I get that. I'm making changes of whether you put pressure on somebody in the back of the neck. Yeah, we shouldn't be doing that. That's quite evident that we shouldn't be doing that. But then what else does that mean when you say that? And I don't know what all that bill would look like. I don't know what all would be put in it. And I don't know that you can get it done in a special session. I would look at things like that to look at to say, if you have a special session, what are you really going to narrowly focus on to get done? And I think something like that probably is more apt to be in the legislative session, where you have public hearings, where you have time to go through that and really analyze that. But I think there's going to be discussions on that in the legislature this year. I think there'll be an opportunity to see that. All right, one more.
Governor, you mentioned a special session. Are you considering, you know, if you were to have one, considering a special session before the veto session, or would that run concurrently?
Yeah, I mean, those are all options that are on the table. I mean, we've talked back in May and June about a special session, just seeing when that would happen. You know, I got to look at cost availability. What's it cost to get people in here? How long is it going to run? What are we going to put in the call? A lot of things like that. So we haven't decided on a time on it yet, but we're definitely, I'm sure there'll be a special session without a doubt between now and the first year.
Okay.
All right. Thanks, everybody. Thank you.
All right. Thank you. See you Tuesday.